So there's very little debate about this. Dr. Gutman is one of the world's leading experts on the subject of glutathione. He has been responsible for, educating more people on the role of glutathione than anyone else in the world. So, Dr. Gutman, thank you so much for sharing your wisdom with us tonight.
Thank you very much, Doug. We're going to be talking about lung disease this evening. But take note of the addresses here. You can always look up more interesting stuff on glutathione on my Facebook page, where every couple of days I post some new research on glutathione. You'll find that very interesting. There's also an interesting YouTube channel where we post these videos, but many other videos on glutathione, on Immunical, and other related topics. And of course, you can find out more about glutathione in my book, The Comprehensive Guide to Glutathione. So lung disease and the role of glutathione. Let's take a look at asthma. It's a good place to start. This is an all too common problem affecting about 8% of our population and about 10% of children. 10%. This figure actually shocked me. I wasn't aware of that actual incidence. It's triggered by a number of different events and causes. The bronchioles, those little airways, to constrict. You see there in the slide, these airways are surrounded by muscular tissues that can be triggered to contract. There's also increased production of mucus in the airways that further adds to the problem, and the patient suffers from a typical wheeze or wheezing and coughing. And these patients can become significantly short of breath. It can actually be a life-threatening condition. Many things can lead to an asthma attack, but by far the most common causes are a respiratory tract infection, like the flu, like a cold, but it could be any virus or bacterial infection. Allergies are the next most common cause. Everything from mold in the house to dust mites and cockroaches and animals and trees and grass exposure. Things that are becoming more and more common are the toxins that are released by air pollution. Things that are under our control are toxic cleaning supplies and, of course, secondhand smoke. All of these can trigger an asthma attack. Typical treatment include inhalers and nebulizers. These can deliver what are called bronchodilators, which relax the muscles squeezing the airways, anti-inflammatories like steroids and other components. In the hospital, a variety of intravenous treatment is also possible. There's been much written about the role of antioxidants and glutathione in particular in asthma. The general consensus is that oxidative stress from glutathione depletion plays an important role in the incidence and severity of this disease, and that more research should be done investigating potential treatment using glutathione elevating substances. Here we have an Immunical study that way back in 2006 looked at kids with asthma. The team was interested into whether the immune system could be positively affected through the use of undenatured whey protein, which is what Immunical is. Asthma can be considered a Th2 cytokine disease. It's a bit of a mouthful, which I won't get into right now, but was suggested that the treatment led to an improvement in cytokine response. You may remember cytokines from our last lecture. In this study, also an Immunical study, researchers looked at exercise-induced bronchospasm. This is a type of asthma triggered by exercise. This is very interesting. You see, it's not unusual to see parents or even coaches giving asthma treatment to some of their players. Those of you who have coached hockey know what I'm talking about. In this university study, there seemed to be a disproportionate amount of players affected by exercise-induced asthma. The question was, why would such a large proportion of otherwise healthy young athletes have exercise-induced asthma? It just didn't make any sense. Well, let me tell those of you who don't go to hockey games that in between periods or in between practices, a machine called a Zamboni comes out to clean the ice surface. Now, most arenas are indoors, and you have this machine coming out at least every hour. Now, these Zamboni machines were not much different from what most fuel engines were. They burned fossil fuel and released it into the air. So once an hour, everybody got exposed. And hockey players can spend several hours a day breathing this in. And this exposure led them to having asthma. So we did a study. We recruited 18 hockey players. They were on average about 25 years old, weighed about 77 kilograms or 170 pounds. And we put them on either Immunical or a placebo. This was a double-blind, placebo-controlled study, meaning that neither the subjects or the researchers knew which group was which. They took either the placebo or the Immunical for 8 weeks. Let's see the results. So for testing for pulmonary function, one test was called an FEV1, or forced expiratory volume at 1 second. You'll see that in the asthma, the expiration times are longer because of constricted airways. And look at the way their numbers improved over the weeks, pretty much back to normal after the 8 weeks. So not only does this study show how improvement in pulmonary function in exercise-induced asthma, it can be also viewed as a toxicological study because it remains possible that the improvement was at least in part due to Immunical's detoxification potential in regards to the air pollution. Let's move on to 3 related problems: bronchitis, COPD, and emphysema. These are all related. Bronchitis is a common enough problem where I can say that many of you out there have suffered from this at least a few times in your life. To simplify, there are 2 main groups of bronchitis. The first and most common is acute bronchitis, which is most often the result of infection. This is usually a viral infection, but it may become a bacterial infection over time. And only bacterial bronchitis should be treated with antibiotics. The symptoms are obviously a productive cough and occasionally wheezing. Then there's a category of chronic bronchitis. As the name implies, this follows a prolonged course, often turning into a permanent condition. The causes are usually inflammatory, with smoking cigarettes almost always being the case. Both of these result in swelling of the tissues of the airways, resulting in restricted air movement, and patients will probably be suffering from shortness of breath besides their cough. Where glutathione fits in potential interventions is as following. There are going to be an overlap in these 2 conditions as well. Raising glutathione has been shown time and again to improve immune defenses. If you can do this, your resistance to infection becomes greater. In addition, glutathione can act as a mucolytic. This means that it can break down mucus so that a productive cough can be cleared easier. Glutathione also reduces inflammation. The chronic inflammation caused by cigarette smoking can therefore be addressed. And finally, glutathione can act as a detoxifying agent, and cigarette smoke contains hundreds of different toxins. COPD, or chronic obstructive airway disease, can be considered a later stage of chronic bronchitis. It's actually the fourth most common cause of death in the United States. About 7% of the American population has been diagnosed with COPD. These are huge numbers. The symptoms are most commonly a chronic cough without an infectious cause. Fatigue is very common, as well as shortness of breath, an ongoing issue. A productive cough is often seen, and often patients will complain of chest discomfort. Again, the most common cause of COPD is smoking, by far. However, COPD is increasingly caused by air pollution, something that is much harder to control. The combination of smoking in a polluted environment is even worse. And there are also genetic causes of COPD, but these are much rarer. Finally, emphysema, which represents the end stage of these diseases. Emphysema develops over time and is the final result of ongoing COPD. It is unfortunately an irreversible result. If you continue to smoke, you can go on from chronic bronchitis to COPD to emphysema. And of course, there are other causes of emphysema, but again, smoking by far is the trigger. Here in this slide, we see the actual change in anatomy that takes place. At the very end of our airways, there are little sacs where gas exchange takes place. These sacs are called the alveoli. Emphysema is the destruction of the walls of these little sacs so that the total surface for gas exchange is greatly reduced. You see them there? This is an irreversible condition. So let's take a look at some papers in chronic bronchitis, COPD, and asthma. This paper here states that oxidative stress is a major driving mechanism in the pathogenesis of COPD. There is increased oxidative stress in the lungs of COPD patients due to exogenous antioxidants and cigarette smoke, and due to endogenous generation of reactive oxidative species by inflammatory cells in the lung. Oxidative stress amplifies chronic inflammation, stimulates fibrosis and emphysema. It accelerates lung aging, causes DNA damage, and stimulates the formation of autoantibodies. Can you see how glutathione fits in here now? Now, N-acetylcysteine, NAC, acts as a precursor for cysteine in the synthesis of glutathione. This paper demonstrates that NAC prevents COPD exacerbations. This is clear evidence that raising glutathione is effective in COPD. Here's a meta-analysis done on 13 separate studies representing 4,155 COPD patients. This is a huge study. Again, NAC had significantly and consistently fewer exacerbations of chronic bronchitis or COPD. Again, this shows clearly that raising glutathione in COPD works to lower this illness. It would be impossible to talk about lung disease without talking about smoking. Most people who smoke for more than a few years will develop at least some type of pulmonary issue. When you look at the most common causes of death, cancer, heart attack, stroke, COPD, all of these are made worse by smoking. It's actually impossible to say how many people die as a result of smoking because of these compounding factors. Besides the increase in stroke and heart disease, let's look at lung disease that are associated with smoking. Bronchitis, COPD, emphysema, lung cancer, all of these diseases are primarily associated with smoking. Each puff of a cigarette knocks out thousands of cilia, those little hairs lining your airways that sweep out garbage. These eventually don't grow back. And each puff of a cigarette exposes you not to burnt tobacco, but to countless other noxious chemicals. And each puff of a cigarette literally burns up antioxidants in your lungs. This includes glutathione. There are many studies that document that smokers are glutathione deficient. Here is a recent article that shows that even vaping, this is an article on vaping, even vaping causes a dramatic decrease in glutathione levels, even vaping. But there's still hope. You can recover to a certain degree after quitting smoking. You may not recover from any permanent anatomical changes that have taken place, but you can certainly recover from some degree of glutathione deficiency. This is certainly good news. In either case, think of replenishing glutathione in smokers as a very worthwhile strategy. Okay, let's turn our attention to cystic fibrosis. Cystic fibrosis is an inherited genetic disorder that leads to severe damage to the lungs, digestive system, and other organs. But most of the cases are pulmonary, so let's focus on the lung issues. Cystic fibrosis affects the cells that produce mucus, sweat, and digestive juices. These secreted fluids normally are thin and slippery, but in people with CF, a defective gene causes the secretions to become sticky and thick. And instead of acting as a lubricant, the secretions plug up tubes and ducts and passageways, especially in the lungs. And these patients, unfortunately, have a shortened life expectancy, around 30 years. Although there are no long-term studies looking at glutathione levels in cystic fibrosis patients, there have been many that have shown that these patients are glutathione deficient. Once again, glutathione deficiency. So a lot of work has been done looking at raising glutathione here. Here is a meta-analysis again of 4 separate randomized controlled studies. They conclude that raising glutathione improved a key pulmonary test, again, the FEV1 in these patients. Let's move on to an Immunical study. The researchers looked at a group of young adult patients. They divided them into a group who would take Immunical and a group who would be taking a placebo. And they had quite some success. A 46.6% increase in glutathione levels was achieved. 45 to 50% increase in glutathione. Pulmonary fibrosis is a late stage of lung damage. This is a lung disease that occurs when lung tissue becomes damaged or scarred. This thick and stiff tissue makes it more difficult for your lungs to work properly. And as pulmonary fibrosis worsens, you become progressively more short of breath. Here we see some of the damage and scarring of pulmonary fibrosis. Symptoms may include a dry, hacking cough, shortness of breath, fatigue, fast, shallow breathing, and weight loss. The cause of pulmonary fibrosis can be either drug-related, radiation-induced, occupational exposures like asbestos or coal, autoimmune, and a type called idiopathic, which means we don't know the cause. Looking at this type of pulmonary fibrosis, it was found that sputum glutathione levels were 1/4 the amount of what normal patients had, 25%. This is a dramatic fall in glutathione. Here's a case report of a patient who was on Immunocal who had pulmonary fibrosis. Normally, I don't present case reports, but this patient I personally knew, and it showed a really important aspect. Dina, that was her name, was a young mother of two who practiced law. She came to me because she heard that I was associated with Immunotech, and she was already on the product. After a few months of Immunocal, she felt so much better, and she had been homebound and relied on oxygen therapy, and now she'd get around without oxygen. She discussed this with her lung doctor, who tested her, and he tested her, and her numbers had gone back to 80% of normal. This was great. But being a true scientist, this doctor could not explain this based on her story of taking Immunocal. So he took her off the Immunocal to see if it really was the Immunocal that was working on her. He took her off. 2 weeks later, she was back in the hospital. Now, I put her back on the Immunocal, and in a few weeks, she was well and returned to near normal pulmonary function tests. So the doctors presented her at grand rounds at the Royal Victoria Hospital, which is a McGill hospital, and wrote this paper. Just incredible. So today, we've looked at a number of different lung diseases that have been related to glutathione deficiency, asthma, exercise-induced bronchospasm, bronchitis, COPD, emphysema, pulmonary fibrosis, cystic fibrosis, and there are likely many more. Here, you have an opportunity to actually try to improve these people's outcome. I welcome you to try. So thank you very much for your attention.